The operating theater aboard the Zentharis Medical Research Station was quiet, save for the faint hum of sterilization fields and the occasional chirp of biometric monitors. Rows of alien medical students stood in structured formation behind a transparent barrier, their eyes some oblong, others multifaceted or glowing fixed on the center table. On it lay a Zentharian explorer named Vrix, unconscious and heavily injured from a shuttle accident during a geological survey on the moon Harnack 6. Lead instructor Yelix, a towering being of translucent blue skin and six-jointed limbs, paced slowly in front of the students. Observe the separation of dermal plates across the thoracic membrane. Bleeding subdermal sacs have formed. The internal pressure has to be regulated before we initiate the 12-phase reconstructive procedure, Yelix said. His voice crackled through the translator field. A student raised a limb. Instructor, is this the incident for which the Terran was summoned? Yes, Yelix replied. The human practitioner arrived 2 cycles ago. We will allow him to observe before we begin. The side door hissed open with a sudden rush of air. A tall man stepped through, backpack slung over one shoulder, a worn duffel in the other hand. He wore a gray utility jacket patched at the elbows, jeans that had seen better days, and a pair of scuffed boots. His dark brown hair was messy, face unshaven but alert. He moved with a limp, favoring his left leg, but his eyes were sharp as they scanned the room. Name's Yancey Greenfield, he said, setting the duffel down. Sorry I'm late, had to reset the translator twice. Your system didn't like my accent. Yelix tilted his head. You are the Terran medical technician. Technician? No, I'm a trauma surgeon, retired. Well, semi-retired. Got called in as a favor to the Interstellar Aid Network. Heard you had a bleeder. Indeed, Yelix said. Our colleague Vrix sustained multiple injuries. We are preparing for comprehensive internal reconstruction. Yancey stepped up to the observation window and looked down at the injured Zentharian. You said he crashed in a shuttle on a rocky surface. Correct. And this, he pointed to the ragged gash along Vrix's upper torso where the thick, translucent skin had torn, is the biggest concern. It is the most visible. Internal damage is likely extensive. We have prepped for full cavity access, multi-tool integration, and neural stabilization. The surgery will take approximately 7 hours. Yancey squinted at the wound. Mind if I take a look closer? Yelix hesitated. This is a controlled teaching environment. You called me in, didn't you? After a long pause, Yelix gestured toward the sterilization chamber. Proceed. Yancey scrubbed in, changed into a sterile suit, and stepped into the operating bay. He moved slowly around the table, eyes darting from one monitor to the next. He pointed to a scan. Right here, he said, tapping the image. This fluid pocket you're seeing, it's not internal bleeding. It's pooled interstitial fluid. See the way it compresses when I push here? He gently pressed around the wound with gloved fingers. The students murmured behind the glass. This isn't a full rupture. It's a surface tear deep enough to look bad but not catastrophic. Yelix's limbs stiffened. Are you suggesting we cancel the operation? I'm suggesting you give me 30 minutes, a needle, and some thread. Silence fell over the room. Thread, one student whispered. Yelix stepped forward. You cannot be serious. This wound is on a Zentharian. Our tissues do not respond to your primitive suturing. Have you tried it? There is no record of a successful suture on Zentharian dermis. Then you're overdue for one. Yancey opened his duffel and pulled out a sterilized pouch. Inside was a simple suture kit: needle driver, forceps, scissors, and a small reel of black thread. Your tools lack the finesse, another student said. Yancey grinned. These tools saved a guy in a collapsed tunnel after a reactor leak on Europa 4. He was bleeding from 5 places, lungs full of dust, and had a broken femur. Lived to tell the tale. Now, let me show you something. He leaned over Vrix and began stitching. Each movement was deliberate. He threaded the needle through the tough skin, drawing the edges together steadily. With each pass, he explained what he was doing. See how the tension pulls the dermis over the fluid pocket. It's sealing itself naturally. No need for cavity access. The students pushed closer to the glass. Will this hold? Yelix asked. Only one way to find out. He tied off the last stitch and stepped back. The wound was neatly closed, the swelling already beginning to diminish. Yancey looked up. Now we wait. If it doesn't hold, you prep for surgery, but I'm betting this saves you 7 hours. Yelix examined the work carefully, scanning it with a handheld monitor. The readings showed stabilizing pressure and reduced fluid retention. Unexpected, he muttered. Effective, Yancey said. An hour later, Vrix twitched and groaned. His vitals climbed steadily. Monitors beeped in rhythm. The students stood frozen, unsure whether to cheer or panic. Yelix spoke. His body is stabilizing, no further intervention required. Yancey turned to leave. You're welcome. Wait, Yelix said. You changed the process. We studied for weeks. We practiced on simulations. And you used a needle and thread. Yancey shrugged. Sometimes the simplest tool is the right one. Not everything needs to be complex. He walked out of the room, leaving behind a stunned group of aliens and one very confused instructor. But as he reached the hallway, his limp worsened. He leaned against the wall, grimacing. A technician passed by and noticed. Dr. Greenfield, you appear injured. Yeah, took a spill during transit. I'll be fine. You require evaluation. Probably, just twisted something. He took a few more steps and collapsed. When Yancey opened his eyes again, he was in a medical bay, surrounded by 3 aliens in surgical hoods. Yelix stood nearby, holding a scan. You fractured your tibia and dislocated the joint. Why did you not report this? Didn't seem urgent compared to that guy bleeding out on your table. You risked permanent damage. Wouldn't be the first time. You must remain immobilized for 4 Earth weeks. Yeah, I figured. Can I get a brace? You will receive proper treatment. Yancey sighed and leaned back. Great, just great. Over the next week, Yancey remained in recovery. He was fitted with a brace and crutches. The alien medics monitored his progress closely, fascinated by the slow, methodical healing process of human bone. Yelix visited daily, asking questions. Why do you not use regenerative fields? Because they don't work well on human bone. Causes cell anomalies. We do it the old-fashioned way, fracture knitting. Fascinating. Yancey looked over at Vrix's chart as he healed in the next bay. His stitches had held. No infection, no fluid retention. You ever heard of antibiotics? Yancey asked. Yelix paused. We use molecular purifiers. Yeah, well, I've got something better for that guy. Penicillin. Explain. Later, I need to elevate this leg. And so the alien students, once prepared for hours of complex surgery, now gathered daily to watch a human talk about sterilization, wound management, and the power of a simple suture. They took notes. They asked questions. Some even tried stitching on synthetic skin under Yancey's guidance. Weeks passed. Vrix returned to light movement. Yancey's leg healed, slow but steady. He walked without crutches by the 5th week. Yelix approached him as he packed his bag. You altered the way we treat dermal trauma. I just stitched a guy up. You're the ones who made it a revolution. You simplified the complex. Sometimes, Yancey said, slinging the duffel over his shoulder. It's the other way around. With a nod, he walked out of the medical wing, leaving behind a station forever changed not by new technology, but by the quiet certainty of doing what worked. The next morning, Yancey sat alone in the station's mess hall, balancing a steaming bowl of something pale green and vaguely oatmeal-like between his hands. He poked at it with a spoon, unsure whether he was supposed to eat it or apologize to it. A low chime sounded behind him. You are consuming the nutrient blend incorrectly. He didn't turn around. That's so. It is meant to be compressed into spheres and ingested whole. The utensil interferes with the enzymatic integrity. Yancey finally glanced over his shoulder. A young Xantharian student shorter than the others, with a pale ridge running from crown to collarbone, stood there with a datapad clutched in both hands. Noted, Yancey said, scooping up a spoonful anyway. He chewed slowly. Still tastes like wallpaper glue. She blinked. At least he assumed that's what the rapid shimmer in her ocular membrane meant. My designation is Rick. May I observe your bone healing process during ambulation? You want to watch me walk, for academic purposes. Yancey sighed and stood, grabbing the crutches resting beside his chair. Knock yourself out. As they moved down the corridor, Rick walked exactly 2 steps behind and slightly to the left, scribbling notes as if his every movement revealed ancient secrets. You always this curious? Only when confronted by contradictions. Such as, you used a needle and thread to close dermal trauma on a species you had never treated before. You then continued exerting pressure on a fractured limb despite structural instability. These choices contradict our understanding of medical logic. Human logic's got more wiggle room, Yancey said, pausing by a viewport that overlooked the docking bay. We adapt. Sometimes that means doing something dumb because the alternative's worse. You accept suboptimal outcomes, we accept the risk. That's not the same thing. Riek scribbled furiously. A soft alarm pulsed overhead and a voice filtered in through the intercom. Medical wing, room 8, assistance required. Yancey tilted his head. That Vrix, Riek checked her pad. Negative. Room 8 is housing a Kirely ambassador recovering from spinal realignment. Yancey frowned. You got anyone in there with experience on multi-spine species? Only Instructor Yelix, but he is currently running simulations on dermal regeneration. Yancey turned and started down the corridor faster than Rick could match. Guess we better go help your ambassador before they sneeze and paralyze themselves. They arrived to find 3 Xantharian medics frozen mid-step, unsure how to approach the writhing Kirely, who was making a clicking thrum noise that sounded like a malfunctioning wind chime. The ambassador's lower body spasmed, one of the dorsal ridges twitching violently. Yancey limped past them and dropped his duffel on the floor. What happened? He attempted to sit upright and experienced a muscular seizure cascade. We attempted to sedate him, but the dosage was miscalculated. Yancey knelt beside the Kirely, examining the contorting ridges. You didn't pad the alignment points. These nerves are hypersensitive post-adjustment. He's overloading. He grabbed a roll of fabric from the supply shelf, cut it into strips, and began padding between each of the twitching spinal ridges. The ambassador's spasms began to slow. Rick, I need a cooling pack, not the gel kind, the evaporative type. She retrieved one from the wall unit and handed it over. Yancey pressed it against the ambassador's thoracic plate. All right, easy now, just breathe. Well, your version of it. The Kirely's clicking slowed to a steady rhythm. You improvised stabilizers using multipurpose cloth, Rick said, wide-eyed. Because they're soft, breathable, and evenly distribute pressure without constricting blood flow. Same reason we use towels back home. Towels, she echoed. Rectangular fabric rectangles, dry things off. Occasionally save lives. The ambassador let out a low, thankful hum, then passed out. Yancey leaned back against the wall and exhaled. You guys really need a crash course in triage. Rick looked at him, then at the unconscious ambassador. We were told humans were reckless, unpredictable. Yet you make decisions faster than our protocols allow. That's because your protocols are written by committees. You ever try to get a committee to agree on lunch? She gave a short, puzzled blink. Never mind. Later that cycle, Yancey found himself back in the medical wing's supply room, sitting on a crate while adjusting the joint brace on his leg. Riek returned, this time with 2 other students, one tall and metallic-skinned, the other with a shimmering frill along his arms. We have questions, the frilled one said. Of course you do. Your medical approaches rely on tactile feedback and subjective assessment. How do you quantify accuracy, experience, pattern recognition, and when that doesn't work, gut feeling? That is not a measurable organ. It's a metaphor. Riek sat beside him, scribbling again. Instructor Yelix wishes to understand why you continue to use fabric, needles, and mechanical supports when molecular tools exist. Because sometimes tech makes you stupid. You start trusting the machine more than your senses. Bad habit. Do you believe our technology hinders us? No, I think you just forgot how to think around it. The metallic-skinned student raised a hand. Can you teach us these methods? Yancey looked around the supply room. You got synthetic dermal sheets, clamps, and a couple practice rigs. We have older surgical mannequins. Good, get 'em. I'll show you how to stitch a wound that doesn't need a power source to close. Several hours later, the supply room looked more like a makeshift classroom. Fabric swatches were pinned to practice frames. Needles glinted in trays. Yancey stood behind one student, guiding his hands. No, not like that. You're pulling too tight. You want tension to hold the tissue, not strangle it. The student made another stitch, slower this time. This is more difficult than expected. Yeah. Try doing it in 0G with your patient upside down and screaming. Another student raised a question. How do you sterilize without a molecular bath, boil water, or alcohol, or fire if you're desperate? Fire. Controlled, obviously. I'm not suggesting you light the patient on fire. More blinking. Yancey sighed and rubbed his forehead. Forget I said that. By the end of the session, several students had successfully stitched synthetic dermal sheets. One had even managed a full closure without tearing the material. Rick stood back, watching the scene. You have caused a disruption in our curriculum. Good. It is not negative, but it is disorienting. You'll get used to it. She tilted her head. You will be leaving soon, probably. Once I can walk without this thing, he tapped the brace, then it's back to wherever they ship me next. Rick hesitated. Would you consider staying longer? Yancey looked around at the trays, the scraps, the eager students practicing loops and knots with alien fingers. I'll think about it. It was late when he returned to the small quarters they'd assigned him. He sat on the edge of the cot, leg throbbing, hands sore from guiding clumsy fingers all day. A message light blinked on his tablet. It was from Yelix. The message was short. Your methods lack elegance, but they yield results. We wish to observe more. Yancey leaned back, stared at the ceiling, and chuckled softly. Of course you do. By the fourth week, Yancey's limp had faded into a stiff walk, and the brace had been swapped for a compression wrap. He still moved slower than the students, but none of them outpaced him when it came to getting their hands on actual patients. They had converted a disused diagnostic bay into a makeshift workshop. The walls were lined with mismatched containers, some containing synthetic dermies, others filled with gauze, sponges, and what passed for antiseptics in local xenomedicine. A few students had even built a hydration unit that dispensed hot water for sterilization, though it leaked slightly and made a whining noise every few minutes. Yancey stood over a training dummy that looked like someone had sculpted a lizard from memory, then forgotten halfway through. All right, he said, adjusting his gloves. Today we're dealing with puncture wounds, not clean ones. Jagged, irregular, maybe from falling into debris, maybe from getting clipped by a pressure valve. Doesn't matter. You treat the shape, not the story. One of the students, whose name loosely translated to a sound made by scraping stone, raised a hand. But if the injury origin defines the contamination level, should we not Yancey cut in? Sure, you consider the contamination. But first, you control the bleeding and stabilize the structure. No point diagnosing an infection in someone who's lost too much fluid to stay awake. The student looked uncertain but nodded. Here, Yancey said, gesturing to Rick, who had become the de facto assistant over the past week. You're handling cleaning today. You remember the alcohol dilution ratio? 70% to 30 distilled, she recited, already prepping the bottle. Good, don't overdo it. That synthetic dermal sheet is expensive, and don't use circular motions. Work outward. You want to push contaminants away, not rub them in. The others gathered around as Yancey demonstrated a side entry stitch, adjusting the needle angle to follow the uneven tier. No vertical passes on this one. The tension will pull the edges open again. You want shallow bites cross-latched. Like cinching a drawstring bag, one student leaned closer. But if the dermy's edge folds under itself, lift it with the forceps. Don't stab blind. You're not quilting, you're closing tissue. They watched as he tied off the thread in a figure-8 pattern. "Why not use adhesive mesh here?" another asked. "Because if the wound's still bleeding, mesh traps fluid underneath. That builds up, causes pressure, and splits it open again. You want to glue it shut after it's clean and dry, not before." There was a pause, then Rick said, "You've never used a dermal fusor, not once." Yancey glanced over. "I've seen what happens when someone does and the wound wasn't prepped right. It looks clean from the outside, then 3 days later it tunnels underneath and rots from the inside out. You want that on your record?" "No," she said, "didn't think so." Someone cleared their throat near the doorway. Instructor Yelix stood there, arms folded in a way that seemed mildly confrontational by Zentharian standards. "You have repurposed a diagnostics chamber into a practical station." "Yep," Yancey replied, not looking up. "Your students needed hands-on." "Now they've got it." Yelix stepped inside and examined the dummy. "This model is not calibrated for invasive procedures. It doesn't need to be. We're not measuring vitals. We're learning how to work with our hands. You have limited the use of scanning tools. On purpose. You want them to learn touch sensitivity. They need to stop staring at numbers and start feeling for tension." Yelix turned to the students. "Have any of you found this methodology effective?" One by one they nodded. Rick stepped forward. "I reduced closure time by 37% using the side stitch method. And I corrected a misaligned seal on a Cadron patient yesterday. No fluid retention." Yelix's gaze lingered on her, then returned to Yancey. "You are aware that introducing non-standard procedures requires approval from the medical board." "That's why I'm leaving tomorrow," Yancey said, peeling off his gloves. "I'm not part of your system, I just fixed what needed fixing." There was a long silence. Then Yelix asked, "Why did you keep teaching after your injury was treated?" "Because someone needed to." He picked up his duffel, now half empty, and slung it over his shoulder. "You've got the tools. You just forgot how to use them like people instead of programs." Yelix didn't respond, but his posture shifted, slightly less rigid. It was late afternoon when Yancey made his way to the docking bay. The shuttle was already warming up, vents hissing as it powered systems. Rick followed a few steps behind, holding a flat case. "You forgot this," she said. He took the case and opened it. Inside was a new suture kit, not fancy but carefully assembled. The tools were polished, the thread wound neatly. "Made it from surplus," she added. "We used your specifications." He closed the case gently. "Thanks." She hesitated, then said, "I submitted a revised wound management protocol to the board. I used your side stitch method and included improvement metrics. They've scheduled a review." Yancey blinked. "That fast?" "They accelerated it after the ambassador wrote a statement. He mentioned the towels." He laughed once, shaking his head. "Of course he did." Rick stepped aside as the shuttle ramp lowered. "What will you do next?" "Wherever the next fire is, I go where I'm needed." She nodded. "We will continue here. We won't forget what we learned." "You'd better not," he said, walking up the ramp. She watched as the hatch closed, the shuttle rising away from the platform with a quiet hum. The station lights flickered once as power stabilized. Back in the diagnostics bay, the students gathered again. The dummy lay on the table, a fresh wound pattern programmed into it. Rick picked up the needle driver and looked around. "Same protocol," she said. "No scans, no shortcuts, let's begin." And they did.